Many people live with chronic pain each day, while prescription opioid pain medications are an important part of treatment. Life-threatening side effects can sometimes occur even for those who take their opioids as directed. Opioid emergencies such as accidental overdose are a growing public health epidemic in the United States, but conversations between healthcare providers and patients and their loved ones about the safe use of prescription opioid pain medications can be difficult to start. America Starts Talking is a new campaign designed to help prompt these sometimes uncomfortable discussions. And here today to share vital information on opioid safety and the campaign is Dr. Anita Gupta, an anesthesiologist who is active in research and advocacy for matters relating to pain. And she joins us today along with Penny Cohen, founder and CEO of American Chronic Pain Association. Welcome, Dr. Gupta and Penny. Thank you for being here this morning.
Good morning, Chris.
Thank you.
Now, first for Dr. Gupta, what part do opioids play in the treatment of people living with such intense pain?
Opiates is one of many treatment options for people that have chronic pain, and an important one. They can be used very safely, but it's important to have those conversations with your doctor on how to use them safely, and also to prevent life-threatening illnesses and side effects that can occur.
And for Penny, you know, people living with pain, what are they going through?
You know, they're going through a huge amount of emotions. They see that their lives, you know, they're not able to do what they used to do. But I think one of the things, and what we're here to talk about today, is the fact that many of them depend on a prescription opioid as part of their treatment. And quite often, you know, there are 44 deaths every day, and 80% of those are unintentional deaths, and that's all due to prescription opioids. So we need to help people better understand what are they supposed to do in an emergency. And America Starts Talking is a website that has a discussion guide that they can use to have this conversation with their healthcare provider. It's a discussions guide to help them talk with their family and their friends, because it can happen anytime, anywhere, to anyone. And so family and friends also need to be well informed about how you react to it, and using naloxone as a rescue medication. And then, of course, calling the emergency department or the 911. So, you know, it has a video on there. So it's really helpful for people to watch the video to understand. And then an interactive quiz and a wealth of resources. So again, at americastartstalking.com is available for anyone to really help them feel more empowered and to understand what they need to do in case of an emergency.
And for Dr. Gupta, even if people take their opioids as directed, there can still be accidents that can happen, can't there?
Absolutely, and again, that's one of the main points of us being here. You know, opioids can be used safely, but as you said, certain drug interactions, other diseases and conditions can alter the way these medications work, and especially if you're not taking the medication as directed. And those could be risks for a potential opioid overdose that's unintentional. And that's what we're here about. That's what this campaign's all about. And the most important issue is to get that information from your doctor. Visit americastartstalking.com to get those resources to help you.
Dr. Gupta, Penny, thank you so much for this important information. Pain is something you don't have to live with, but you have to be careful about what you do with your medications.
Absolutely.
Thank you.
Thank you, Chris.